Hi, I'm Dr. Richard Facko, a pediatric dentist and dad of 4, here to answer questions that you might have about kids' dental health. So one question that we get a lot at the office is, at what age should I bring my child to a dentist, whether it's a pediatric dentist or a family dentist? And maybe I'll give you a little bit of background on why the recommendation is the way it is. And what we do see at the office is a fair number of kids, 3, 4, 5 years old, who have cavities or a whole lot of cavities and have some pretty extensive dental needs. So our hope is to get to meet with you and your child at an early enough age that it's highly unlikely that they already have cavities, so we can work together and come up with a plan to establish some healthy habits at home, whether that's through diet or hygiene and other tips that we can pass along. But all of that's done in an interactive process in the office, kind of interviewing back and forth, asking questions about things that are currently going on at home, and us asking, which solutions might be most practical or able to be implemented in each household. So everybody's different, and so the approach is kind of tailored to the individual. When it comes to the actual visit, I know that a lot of parents are kind of stressed and anxious about what might happen with such a young child at the dentist. Will they cry? Will it be a traumatic experience? Will it be traumatic for my kid? Will it be traumatic for me? And the process we use is we start with an interview style interaction, so just collecting information and talking about some recommendations to establish healthy habits at home. We do get to the point where we will then brush a child's teeth or a baby's teeth just with a regular toothbrush like you would at home. And a lot of times they'll sit in your lap for that part of the visit. They might cry, and that's okay. It's brushing just like you do at home, and we might get resistance just like you do in your own home. But we'll then brush the child's teeth with a toothbrush, help establish that this is a friendly place and that they're able to do things that they hadn't done in the past. We'll then do an exam with a mirror, so just taking a peek and making sure that everything's on track developmentally and that we don't see cavities, of course, but some more subtle, earlier signs of cavities that dentists can pick up on that might not be as obvious at home. Also checking out hard and soft tissue and just making sure that things are developing as they should, and then giving you some guidance on what to expect, what's normal, what's not normal, hopefully giving you some peace of mind so that when things do come up at home, we've already had those conversations, and you can rest assured that things are okay and that everything is happening as it should. So to me, it's a fun visit. It's a lot of prevention talk, and there's a lot of subtle details that come out in some of these conversations, tips and tricks, and we don't have to turn everybody's world upside down. Life doesn't revolve around oral health, but trying to work with people to come up with habits and solutions that work for each family and for each individual is really our goal. At the end of the visit, we typically apply fluoride varnish, something that we apply twice a year at the dentist. Of course, that's part of an informed consent decision, and in our practice, we value each individual's ability to decide what they feel is best for their kids based on the information that's out there. So, we're happy to answer any questions about fluoride that you might have at that visit. And from there, we typically see kids every 6 months. So they get on the same kind of schedule as you do as an adult. And the hope, the plan is to keep them healthy from the start and never run into those bumps in the road. But also those early visits do help to establish a relationship and some level of trust between a doctor and a parent, or a doctor and a child, so that if they do have issues down the road, that relationship has been established and we have something to kind of lean on at that point. I think it's a great opportunity for parents to ask questions and maybe even challenge the dentist with questions or your values and priorities to see how the dentist reacts and adapts, and hopefully is willing to work together with you to come up with solutions that are practical and realistic for your family. So it's a good way to kind of test out a provider in a low risk, low stress environment and situation. Again, hopefully never relying on that provider in a high stress situation, but at least having established that relationship, I think is really beneficial. So as always, if you have questions, comments, please leave them below, and we'll try to get to your questions as they come up, and I look forward to seeing you soon. Again, Richard Facko from Palos Pediatric Dentistry, and we'll see you soon.